Hi, I'm Dr. Prabjot. I'm a pediatric neurologist at KIMS Cuddles, Hyderabad. So let's speak about or talk about pediatric epilepsy today. Pediatric epilepsy is one of the commonest things that as a pediatric neurologist I end up seeing in my OPD, which is true for most of the other pediatric neurologists as well. So epilepsy pertains or it is a condition in which a child has two or more seizures or even after one seizure we know that there's a chance that a child may have multiple other seizures. Now, there are a lot of misconceptions which are associated with epilepsy. The commonest one being that the child with epilepsy doesn't need treatment, or if we treat a child, the child may become very habitual of the medications. Now, epilepsy is something, and there's a lot of taboo associated with epilepsy. Many of the parents do not want to let the school know or the neighbors know that my child has epilepsy. Now, epilepsy is not something that should have a taboo associated to it. Most of the people living with epilepsy do well in life. Almost 70 to 80% of people with epilepsy are going to lead a normal life when they are treated well and the seizures are well controlled. So hence it is very important that epilepsy be diagnosed on time and the appropriate medication for the type of epilepsy or the type of seizures that a child has be started on time. So most of the patients with epilepsy do well on one or two medications for epilepsy. That means the seizures are well controlled and kids continue to do whatever they are doing in daily life. Now, a small percentage of kids may not do well only on medications and may require additional medications or additional interventions as well. Now, coming to the investigation part of epilepsy. So, see, most of the time, the diagnosis that the child has epilepsy can be made only on the basis of a clinical interview. And the decision to start medications and which medications to be started can also be taken. Usually, the first line investigations for a child who comes in with a seizure include a brain imaging, which is typically a MRI scan of the brain, and an EEG. EEG or an electroencephalogram is something akin to ECG for heart. However, the ECG is done for the brain to look at the brain activity. Now, both of these investigations may be normal. Now, this is again a common question which is asked by the parents. Now, if my child's investigations are normal, does that mean I do not want to start medications, or does that mean my child does not have epilepsy? Now, we need to know that the EEG as well as MRI may be normal in almost 50% of the kids who present with the first or second episode of seizure. It does not necessarily mean that a child does not have epilepsy. What it means is that a child has seizures or epilepsy, but the tests are normal. It also does not mean that we do not need to start on medications. So it is a good idea to start medications or not start medications as the discussion with your epileptologist or your neurologist or your pediatric neurologist is. After this, the medications are to be taken regularly, not to be skipped for a period of at least 2 seizure-free years. That means we count the time from the last seizure till 2 years till the child is seizure-free before we can take a decision or think about withdrawing medication. Now, coming to the side effect of medications, yes, any medication has side effects. Again, this is a common common query that parents ask that, doctor, my child is taking medications for a long time. Does it not have side effects? There is no medication that does not have side effect. But what we need to do is we need to balance out the side effects with the condition or the seizures that a child is having. That is why we request patients or parents to come in every 2 to 3 months so that we can have a checklist of how is the child doing, are there any medication related side effects, are the side effects significant enough that we need to switch on to other medications, and so on and so forth. So epilepsy medications have to be taken on time, not to be missed, to achieve a good seizure control. Now, a few kids who do not respond well to only medication may need higher end investigations beyond just a plain MRI and EEG. In case their seizures are very frequent or even after medications they continue to happen, we might ask for an expert epileptology review to see if there is anything additional we can do in such kids. So in case you have a child who is known to have epilepsy, is not well controlled, or is off medications, is not taking any medications, please do see a pediatric neurologist or a neurologist or an epileptologist so that we can start appropriate medications. And most of the times, we can provide a good seizure control to most of the people. So I hope this was helpful, and kindly do reach out in case of any queries related to childhood epilepsy. Thank you.